Okay, everyone, this is Dr. Sharrier, and we're going to start now. I hope so you can hear me, first of all. So we're going to have a session on the AMC, Australian Medical Council. I hope so all of you going to enjoy this session. This session, consists of two parts. Firstly, I'll talk about some of the inquiries, that is very commonly asked. I'm being an instructor for last 3-4 years in AMC. Many students who pass under my guidance. So every year, every time we got a lot of type of questions for everyone. So there's a lot of type of students. Some are students 5th year, some are intern doctors, some are resident medical officer, many are consultant among them. So everyone has some various question. I just summarized all of them so that I can discuss. So I hope all of you are going to enjoy this session. Okay, and if you have a friend, please tag them in this session, in the comment section, because there won't be any available recording later. So I request all of you to tag your friends, so that they get to know this session. Okay, so I request again, before I proceed, you all need to tag some of your friends, if someone is new, even medical students, so requesting again to tag some of your friends. Okay, so it's a lovely day to start the class, and this session, as I said, is mostly based on the frequently. Like today, there'll be two type of session. One is this one, the frequently asked question, and another one I'll show a lot of questions, how to solve them. Okay, so it consists in this way. So let's move forward with the very first one. Okay, this is my profile. Maybe some doctors always interested asking what you have did, so this, first of all, I like to be in the teaching field. So I'm a CEO and founder of Sherry's Medical Academy, and also chief teacher. So along with me, there are a lot of other teachers, many are working from Australia, some are working from India, some working from Bangladesh, as in my academy. So it's an online based academy. And I did, I've gone through this whole AMC process, MC1, MC2, I've gone through FCPS, and I've gone through diploma, some of the certified course. I'm a fellow and also working as a general practitioner. So let's just move forward. Let's talk about books, first of all. So talking about the books. So here's something about AMC books, you might be interested. Always it is told visual impression are always good, so I just thought to brought the book pictures, for all of you. So I'm sure you can recognize this one. This is the John Murtagh. It's the 6th edition, but nowadays 11th edition is available in the local markets. Is available. Those are in Australia, they can purchase over online. There's a good book, Master of the Body, even though it's a USMLE book, but we strongly suggest to read that one. It's a very good book to start it with. And another official book is a MC Handbook of Multiple Choice Question. This is another very famous one, MC bestseller, but currently we turned off this one for updates. Then there is RSCGP. I'm sure if you have any plan for Australia, you should know about RSCGP. There, everything is maintained by RSCGP. So RSCGP has their own guidelines actually. So you can see the apple shape, this one. So RSCGP guideline, currently it's also known as Red Book, and the Red Book is currently 10th edition is available. Then there are AMC Bank. You can purchase AMC Bank online. Nowadays there's another bank, Amedex Bank. It's more new. I heard it's very good as well. And at the same time, some of the Kaplan series you can follow. So Kaplan books are always popular and very concise, so it's an easy book to start it with. But when you go to more deep, this Kaplan, so won't be enough. Some doctors ask a question doctors, I'm comfortable with Kaplan series, can I proceed with that one only? No, it's not true. You need to read the John Murtagh and some of the relevant books at the same time. Then you will find another book like the Anthropometry, then this annotated multiple, these two are very old book. Anthropometry has anthrology, sorry. This one has some pictures. That's important for medical ethics. So far we use the 100 case of medical ethics. So these are the some of the books names, and apart from books, you might be interested, what are the subjects you need to study. So because not everyone have that idea, so they have the similar idea like USMLE, maybe it's a similar exam like USMLE. No, this is not similar like USMLE step 1. This is similar like USMLE step 2 CK. I repeat, USMLE step 2 CK, where all the clinical subjects. So in AMC part 1, all the subjects are clinical. What do you mean by clinical? That means like the typical anatomy, physiology, biochemistry, microbiology, pharmacology, some of the community medicine, weird stuffs. Those you don't need to read in typical way. Yeah, some relevant clinical things might be required, but not the typical one. Okay, only one subject from the basic, if you can read in details, that's pharmacology, because a lot of questions are tested from pharmacology. But still they're mostly clinical pharmacology. But we strongly suggest, every doctor should have good idea about, clinical pharmacology. Sorry for the spelling mistake here. Okay, and there are some relevant, subjects, it's given. You can see like, there's subdivision of, medicine like respiratory, GIT, and all those things are written here. Then gynae, obs, renal system, psychiatry, medical ethics, so it's all those things. As you can see, these are the subjects. So I'm just pausing here, so that you can see, go through for a while for 10 seconds. If you want, you can take a picture. That's totally up to you. Okay, so these are the subjects, like in generally, different thing, from cardiology more question comes, in neurology more questions come. So there's certain subdivision of the subjects, and where you should put some more emphasis. Okay, now like a very common thing, like, doctor, how can I start the AMC process? How can I get registered? How can I, I want to get through AMC, how to appear in the exam? Like every doctors let first you need to open an account. I repeat, you need to open an account first here. Okay, so you can go to www.amc.org.au. I'll show you that one very shortly. So you have to go there, you have to open an account, and that account is called AMC portal account. Or you can just type Google in the Google, AMC portal account. So any account, whenever you see there is a sign in and a sign up, as a first time, you need to sign up. During sign up, you'll be asked your name, your date of birth, your country, your medical college, blah blah, a lot of those things. You just need to fill up those one. And if at some point, if you feel like you are not sure about that one, you can just log out. It will be saved up to that part. Okay, so no need to worry. And for primary verification, you need to open that portal account, and you need to put some money there. And initially you have to put like $350 or 500 Australian dollar. Even if you go to USMLE exam, PLAB exam, this verification, all international medical graduate, they have to go to. Okay, so don't think it's only for AMC, for every exams. What is the proof? You're a medical graduate even. Okay, but they don't know. So that's the process. So you need the photo with 2x2 with white background. Then of course your recent passport. If you have less date in your passport, please change the passport and then make the account. Then MBBS certificate. It's also known as medical diploma certificate. They don't write medical, they don't write MBBS certificate. They write medical diploma certificate. Okay, you got my point, I hope so. Then the credit card, you need a credit card. Either you can use your one, or you can ask someone who lives in any other countries, might have more credit while paying, because credit card also has limits. I live in Bangladesh, so here the cards has a lot limits actually. But if you want to pay a big amount for AMC, in the exam fees is quite high, so when you want to pay that, you have to tell the bank separately, or either you have to have that kind of capacity of your card. So make sure that one actually before you proceed. Okay, at any point if you want to ask me something, please go and ask me. I don't mind. There's a comment section, I'll be happy to answer some of the questions. Okay. Also, those of you who are attending right now, I just request, like, if you can just respond with a yes, so that I get to know, like, how many of you are actually attending the class. Okay, so this one would be very helpful. I'm telling you, a lot of new things you'll get to see right now. Okay, so in the first session, actually, so and then comes the recall thing, the crazy stuffs. Okay, it's like, we are burdened with this kind of so many recalls. So standard, we say you need to solve last 1 year of recall. I personally have seen, if you solve 6 months properly, that's also enough. Some people, they don't do the recalls properly. They just say, okay, this is the answer, okay, this is that. This is not a good way. You need to learn the differentials of anything. You need to learn what is the differential diagnosis. So that's very, very important. Like, you go through the differential zones of those recalls. You never know, recall is creepy thing. Recall is something they have missed, like the recaller has missed. Often I call the recallers as agitated psychotic recallers, like, because after exam, you never know what they're doing. Like, people start feeling crazy after exam, some start drinking. So you never know, they might make a lot of mistakes while writing a recall and while uploading. Okay, so that's the thing. So as I said, standard 1 year, and 6 months, if you do properly, that's enough actually. Okay, and in last 7 days before your exam, don't forget to revise the last 3 months recall at least. Okay, so now we are getting into a session that is called the frequently asked question, that particular session. This session, I'm sure, would be very helpful. Okay, and I just want to request, like, if there are more candidates in this group, please tag each other so that they can see this session as well. Okay, now, like, some distribution in the marks. Okay, so distribution in marks, like, before I start, like, just want to tell you, this AMC exam, is a 3 hour, 3 hour 25 minutes exam. Basically, like, basically better to say 3.5 hour exam, and you have to solve 150 question. That means for one question you are getting 1.5 minutes. So that's pretty less sometime, but if you have good preparation, it's not a problem. If you want to know about the distribution of the marks, like most are tested from medicine, then a big number from surgery. Like, I often recommend, while taking preparation, medicine, surgery, all together, if you can take a good preparation, that's always good. Like, example, renal and urology, like, separately, no need to read renal and then again urology. You don't need to do that. Renal, urology, you can read together. Only per the general surgery, that you can do in some other time, and but the systemic things, I recommend you should learn all together. Then the gynae ops, pediatrics, then this psychiatry, and some statistical population health type of question. So you must be thinking, why I told 150 and now it's displaying that just 120. So where are the other 30 questions? Can anyone tell me here, like, where the other 30 questions comes from? Any ideas? Like, you can write in the comment section. Okay, so another one, we are talking about the pilot question. What do we mean by pilot question? Anyone have any idea? Pilot question, here is little definition of pilot question. First of all, let me tell you this particular thing, that this pilot question that does not have so 0 marks question. I just want to write that one. The pilot questions are 0 marks question. Okay, so these are, I can say, trial questions. So why they put in exam? They, trial means trial, like it's under process, and someday if they have more good evidence on that one, so they start putting them as main question in future. So I just want to highlight this line again: no marks in pilot question. Your next question would be like, doctor, do I know like which one is pilot question out of those 150 question? The answer is no. You don't know in the exam hall which one is a pilot and which one is a non-pilot. Basically, you have to go through all these questions, in 3.5 hour. In 3.5 hour, that's all you need to know. That's the thing. Next one, Okay, this is how a exam answer sheet actually looks like. So after you pass, you'll get a score sheet like this, and they will give you a reflection. You can see one thing very interestingly. You give the exam in 150 questions, but your marks are coming out of 500, like in this way. That means every question carries around, like 4 to 5 marks. We never know, like which one carries how many marks. So this is called some kind of percentile system. Percentile system. I tell you why, like many people don't know. Even when you're studying here, they don't know what is this. So this percentile system means, suppose I give you an example of my last November. A lot of candidates from my academy and many academies, they went for exam. So since this is something at the end, this exam, like just to tell you, the AMC exam held from January to November. In the month of December, and sorry, from February to November, sorry, my mistake, February to November. This December and January, no exam. Okay, so during that month, okay, in the month of November is always a rush. So many candidates, they always go in the month of. So what happened, that percentile system might change. If too many people are appearing in the exam, too many good candidates are appearing in the exam, so the total mark will will be very high, and more people are getting more higher marks. So now, like, the bottom marks will be changed now, and that is the reason, luckily, all my candidates except for one, like that was dropped, but other 33 passed from my academy during the last November. So I didn't realize initially, but when I heard their marks, the marks were a little low compared to the October, September, the August candidates. And the reason is because it's a percentile system and all were going in November, and thing happened, like everyone was getting more, so in total they reduce the mark thing. So this is the percentile system. It's a quite weird system. It's kind of like, those of you play cricket, I'm sure you know about the Duckworth Lewis, that method. Like, it's a quite weird thing. Only they know, how to calculate, depends on those lot of other aspects. So this is something, you need to know actually. But, there is, some people might ask me, doctor, which is the favorable month for the exam? There's no such favorable month for the exam. Every month where months are similar, and we tell our candidates mostly, like go like every month except for maybe February, because but in last February there are a lot of candidates, they were appearing and the result came good. So nowadays we feel like none of the months actually does not matter, neither any center which matters actually. Okay, so so don't think about those things, like which particular month to appear, which center to choose, like those are just rumors. Okay, just to clear you, all of you. Okay, so now this is the official website of AMC. I just want you to those of you are new right now here, I just want you to type this one, www.amc.org.u. just go to Google and type it. I'm giving you 10 seconds to do that. You should see this particular thing one time. Okay, so as you can see, I hope so it appeared. So when you open this one, it looks like this. When you click this one, these things will appear. If you want to know about AMC MCQ, then click MCQ. Like if you want to know clinical, then you click MC clinical. When you click MC MCQ, you can be able to see what are the months the exam dates are, what are the months MC clinical exam dates are. It is true, it is little tough to take the MC clinical dates, but if you know how to take it, you can take it actually, to be honest. So this is the main website, and this is the main how the website actually looks like. And when you click this, a lot of things will pop up. Okay, so fees, charges, all these things. Okay, so now this is the website. When you click this, a lot of things will pop up. Okay, so fees, charges, all these things. So it has two parts. All of you know, like AMC MCQ, the centers are in multiple countries. Okay, AMC clinical centers, only one center for AMC clinical, and that is the Melbourne. It is known as, the Latrobe. It's very near to Melbourne Central Station. Okay, so again, it's of two parts. And about the English test, okay, let me tell you the difference between PLAB and AMC. In PLAB exam, you need the English test to appear in exam. For AMC, you don't need the English test to appear in exam, but when you apply for the job, you need the English test. So eventually we need it, but while appearing in exam, you don't need the English test. Okay, so for applying job, how much, what's the score I need? A frequently asked question. You need IELTS band 7. It's pretty tough. But the easier versions are here, like, OAT, grade B. So you can go for this one. There's another test, like that's PTE. For PTE, you have to get 65. Okay, so these are the certain things, okay, you need to know. Next up, exam centers. Where are the centers? So as you can see, there's so many centers everywhere. You can just check whatever the nearby center, or maybe your country already have center. Say, I took my exam from Delhi. Some of my friends take the exam from Thailand and Singapore. If you are already in Australia, you can take it from Australia. But other many countries like China, like, this Turkey, so many countries has, like, especially Australia, New Zealand have a lot of centers. USA also have a lot of centers. Canada also have a lot of centers. So there's a lot of centers everywhere. Okay, and one more thing, frequently asked questions, like, can I take MC1 exam from other country using a tourist visa? Answer is yes, you can take it. You don't need to send the exam documents, all these things. You can just apply for the tourist visa. So that's more than enough. Actually, some doctors might have this issue, like, which visa to apply. While applying, they get confused. So I'm just clearing that one. I take my exam, both exams, with tourist visa. So it doesn't matter, guys, what visa you are going through. And it is clearly written in AMC website, the AMC has nothing to do with the immigration department. Okay, so this is a small sneak peek from the Melbourne Central. I'm just going to show you. Here is Dr. Sherrier, and behind me you can see there's a big building out there, and that's the center. And behind me, like, there's another big building. So that's big building is in front of the Melbourne Central station, and the directions are not given well, and that's the problem. So you have to come through through that, behind that big building, and then come across. There's a Chinese shop, and you have to come through this one, like this is 300 Latrobe. Okay, just remember 300 Latrobe, that's the street. I'm showing you again that one. This particular building just behind me. So yeah, this one, 300 Latrobe is written here. Okay, and there's two coffee shops downstairs. So, and you have to go to the 14th floor. Thank you, this is Dr. Sherian. Okay, so now let's get into, like, these videos you'll get in YouTube. So frequently asked questions. What are the things you need to bring in the exam hall for AMC MCQ exam? So for AMC MCQ exam, like, you need to bring your passport. That's the main verification thing. Also, it is better if you can bring your driving license. That's also okay. Also, at the same time, you take your bank card, with your signature or your name written. Okay, so these are the particular things you need to bring in the exam hall, along with your placement letter. See, when you will put the money after finishing the formalities, then they will send you, they'll give you the option of choosing center and date. When you schedule a date, you'll get a PDF. Okay, so they'll send you email. Also, while scheduling, you can also download the PDF form, so that you can take a printout and take that one along with you. All the whole address, the metro station lines, all the direction are given very nicely in that one. Okay, next up, is talking about the face. Okay, so talking about the face, as you can see, all the direction I've given. So about face, you see less, little bit higher. You know, it's a big budget exam, MC1, MC2. So in US dollars, I also gave. In Australian dollars, I also gave here. Okay, so let me give you a summary. You know, because even in my office, we have a beautiful office in Dhaka, Bangladesh. Is 369 by B. It's Khilga Thaltola, that particular area. So I also help many junior doctors. Like, you know, if you have inquiries, do come, feel free. So often, you know, there are a lot of type of doctors, like, doctor, what's the budget? So, you know, dear doctors, like, you know about the more budget, that's the USMLE and the MC. If you have less budget, you go for PLAB. Okay, otherwise, you know, at certain point, you know, you might get stuck and you don't have that, you know, resource of money. So because you need a certain money for AMC first. Yeah, but good thing is, you know, they pay well compared to the UK doctors. You know, they're paid very well. Okay, so next thing they might ask, can you give me a, you know, particular idea in total? Okay, like, you know, what are the expenses? So exam fees for 2 exam, air travel, associated food, you know, while staying, unless you have a relative, you know, this particular thing can be skipped. In a hotel, I think 70 USD or 90 in Australian dollar. I would say 90 or 100 Australian dollar per day. If you share with someone, then it will be reduced. Okay. Some doctors go to Australia directly. They're very crazy. No, I don't. I just want to enter first, and then I'll start taking preparation. Not a very good idea always. You try to finish your MC1 and then go to. But if you make your mind as I want to go, and, you know, so you will get 20 hours per week for working, and you will get money. Normally, they will give you, you know, $22, $23 per hour. Okay. So if you work for like 6 hours, you can just calculate like 20 into 6, 120 to 150. You can earn like this. Okay. Next up is, and thank you for appreciating, and if it is possible, tag some of your friends so that they can see this. Okay. And this is certain thing applying for AMC MCQ exam. Always you have to maintain this one, this particular one. You need to take a picture of this one. If you're new, please take a picture of this one, that HTTPS candidate, like, you know, everything will be handled by this particular profile, and every step they'll send you email, like, you know, what is the update of your verification. You know, they will send you an email at every step. Okay, you send all the documents, they will send you email. Okay, we got your email, it is fine. Then they will update, like, you know, it is sent to your college. Then after verification from your own college, then again they will, you know, send the papers. Okay, now here is a point, like, you know, some of the medical colleges, different medical colleges are very different. Some medical colleges you have to keep that money of the courier. Some of the medical colleges it is not. Okay, in my medical, I went personally and I gave that register money for the DHL, because when the document came, you know, because that sometimes you never know, like, you know, because of the money they might not send a courier. So, you know, I just for safety, I went there and I gave the money. Okay, so they didn't send my courier all my documents, even though those are confidential documents. They are not allowed to show me those documents. Okay, so they just said, like, you know, the documents came, maybe you can give us the money to send the courier. Okay. Okay, any questions, please do ask, actually. Okay, don't mind. This is how a sample exam question looks like. Okay, so this is how the questions look like. These are multiple choice questions, like single based answer, like there's no true false. This is like one you have to choose here. So multiple choice questions, 3.5 hours, no negative marking, 150 questions. Whole exam will be in computer. Okay, so that's, please mind it. Some doctors make mistake. Maybe they're expecting hard paper, as like in medical colleges, it's not like that. The whole exam is in computers. So you have to be good with computers, guys. I always give emphasis to everyone. If you want to be a good doctor, or if you want to be a doctor in Australia, make sure you're good with computers, because every patient profile you have to maintain in computer in future. So while taking the interview, this is another reason many doctors don't get the job. No offense, maybe some of the female doctors might need to be increase their skill in the computers rather than in mobile. There's some I found very good with mobiles, but when it comes send me an email and all these things, they don't do that actually. But you need to make a habit of writing a proper email, proper things in proper way. Okay, right. Yeah, this I think about the something same, like you need the passport, you need, like, there's some document things are given, like what are accepted. These are taken from the official website. So copy of driving, these are allowed, or debit card or credit card, or statutory declaration. So a lot of things. So passport, driving license, or I took two things. Let me tell you, I took my passport, I took my bank card. Those were enough, because it was very easy. See, inside the passport, I just put the card. So it was very easy to give them. But if you have more documents, bigger, separately, you will be crazy while entering in the exam hall. So you just have to give the, passport, and inside just put the credit card. So that's fine, totally. No, you didn't need it, doctor. Like, one doctor asked me, doctor, like, own national ID. It's better to take it, actually. I took it in my exam hall, but they don't ask for it, to be honest. And in some of the countries, the national ID card is written in different language. Even in my country, like, nowadays there is smart card, that's everything written in English, but the previous card was written in my own language. So you need, again, translation or translated thing. Believe me or not, one of my candidate, even he belongs to India, and he went to Indian center, and those people don't allow him to enter is only because he took a photocopy. He took the passport. He was just begging, literally, that please allow me, just after finishing exam, I'll bring it tomorrow to you. But they didn't allow, and the exam thing was cancelled. And he was, even though, refunded, but the exam was in November, and the next exam was in February. So you can see how much hassle it could be. So just be careful about this thing. What I did, I took 2-3 backup things. I took my, like, for us it is called BMDC. I took my BMDC, like, or whatever extra documents I have, everything original I took along with me. Don't take any risk. Okay, you never know. Different center, different people are very different. So you never know sometimes. Okay, one doctor asked a very nice question. Do we need to get pass grade in every? No, it's not like in total. The passing in total, the thing you were telling, that's applicable for that AMC, clinical. Yeah, the question you asked, I got, like, every particular, like in AMC clinical, if you go, you need to put in certain stations from pediatrics, gynae. There's certain rule, but not in AMC MCQ. It depends on the number of questions you covered. Okay, my exam experience. It was good. First of all, I booked a ticket, like, of course, like, I was going from Bangladesh to Delhi to appear. So I went 2 days prior my exam. I always do whatever exams I have taken in my life, no matter this AMC or FCPS or diploma, whatever exams I have gone through in my life, I always went to see my center. Okay, like, of course they won't allow you to enter, but I went there, I see those things, that creates some impression in my mind. I don't feel I was in a unknown place the next day. Okay, so no matter you are living in Australia, your husband might telling you, okay, I know the place, I'll just drive you there. Don't listen. If you have an exam center the day before the exam or 2 days before the exam, just go there and see that one. That will, release some of the stress, believe me. Okay, so after we went there, I stayed in the hotel. just make sure you know which country you are coming from. See, India, Bangladesh, Pakistan, these are similar countries. We are habituated with food, each other countries. So you know, but I found few doctors like you know in the Delhi, like after exam I get to know them, like they said, you know, man, we are starving, like we just you know bring some canned food, and some people told, you know, if I eat them I might have diarrhea. And even I, you know, he took something tea and he was having some little gastric upset, one of the guy. So if you are from some certain other countries, you know, you can bring your own food, okay, if it is applicable. If you're going to Australia, they won't allow you food, but in some other countries, you know, they will allow you the food. So you can bring some of your food, okay, if you're not comfortable with especially Indian cuisine and all this thing. For us it was fine. I, you know, I was very happy yeah, with the food actually. So I was even eating more actually. I think in the last day, whatever happened is supposed to happen. I was traveling, I was, you know, literally doing party and all those, like, you know, kind of like that. Okay, so just make yourself chill in the last day. It sounds crazy, but it works actually, because what is supposed to happen at the day of the exam will happen. Literally studying whole night yesterday, nothing gonna change, trust me. Okay, so that's the exam. It went out good, I got very good marks, so ended well eventually. So then, because Delhi is a very good place to travel, so after exam I travel around, so it's a good experience. Okay, one doctor asked, like, is it possible to, you know, appear the MC1 exam during internship? The answer is yes, you can appear in the exam, but make sure you have the MBBS certificate or medical diploma certificate. You might be asking, doctor, with the provisional certificate, can I, you know, do the verification process? No, you can't probably. Otherwise, the exam result would be withheld. If you see any month's result in AMC, lot of results are given star. What is those star mean? Anyone knows? Those star means these results are withheld. That means these guys probably appeared in during internship, or their verification is not complete. That is the reason, you know, the results are withheld. Doesn't mean they're failed. Doesn't mean they're failed. Okay. Okay, eligibility criteria, doctor, you just need your MBBS certificate and the complete one, not the provisional one. Okay, and the passport, of course, a recent passport, and a good background photo, and of course, a lot of money. Okay. Okay, so this is very commonly asked questions, like AMC MCQ exam. I often got question, I'm a beginner, how to start? I want to buy minimum books. I want to start with only required books. Yeah, budget is a big concern everywhere. I'm a fifth year student, what books I should follow? I have money problem to buy all books at a time, so what book I can? So you can see all of them are similar kind of question. Here's your answer, guys. You should start preparing with the John Murtagh. That book is quite cheap in Bangladesh, India, and Pakistan. We don't have that much issues with copyright, so the local color copies are available, so you can just purchase them in very cheaper price. If you're in Australia, unfortunately you have to buy the original, unless if someone is going to Australia, they can take the books. Apart from them, MC bestseller, MC Bank, MC handbook, Kaplan psychiatry. Okay, so these are could be the minimum books. But if you have only John Murtagh, you can also start preparing some of the other books. You can use the soft copies. So here, if you want to reduce the budget, only book you should get is John Murtagh. Some doctors might tell you from first to last, John Murtagh, read everything. Total wrong conception. Okay, so you know, just be specific. What are the things that is required from John Murtagh? Only read them. Okay, in our preparation courses, we tell them separately that, you know, what are the exact points are actually required. Okay, now, like, how long are my results gonna valid for? Now, this question comes so often because there are PLAB exam, there are MRCP exam, and in those exams, the result get invalid after certain time. Here is the good thing about the AMC. You know, that is the reason I encourage people. You never know, like, you know, you can, if you pass, that is going to be valid for your lifetime, and it's an achievement as well. You'll get a paper that's showing that you passed. So it looks good actually, even though someday you don't go, like still it's okay. Okay, but later you might change mind. So now you are fresh, energetic, so it is better you finish the MC exam in quick session. Just 6-7 months preparation, you can pass the MC1. Okay, one doctor asked, like, is there that much difference between 6th to 7th edition? Doctor, I would say 20% changes. You will find always some changes in the treatment section. Okay, where to see the changes? Always track the changes, especially in the treatment section. A lot of antibiotic changes I personally found, actually, so that I can tell you. And if you're appearing after May, June, I think you should get the 7th edition. If you're appearing before June, I think it's fine to go with the 6th edition because you were already preparing. Okay, now a very vital thing, a lot of doctors are like, those of you are already having peer through your spouse, like that's a different issue, you already got the peer, but not many people have the peer. So these are all the subjects from medical background. If you want, you can take a picture, guys. Okay, so these are all the medical background things which is in the SOL list. SOL list, you understand? SOL list means it's in the peer list. Okay, see, critical care gastro, like even specialist has also a lot of things through the specialist pathway, but it is pretty tough for the specialist. Some doctor ask me, doctor, I want to be a specialist. Yes, you can, but you have to pass the MC1 at least, then you can go through some of the specialization later. Okay, now one more thing, like there's multiple pathway to enter Australia. I think the commonest way is getting married. Someone who is already having Australian peer, you'll get the peer just after 6 months. Student visa, you choose some of the wide subject, like example social science, example like nursing, example like ultrasound. So there are certain things which those subjects, like let me tell you another big mistake made by doctors these days, that they choose the MPH. Just to tell you, there is no option for MPH to get PR these days. Okay, just to clear that one. Okay, now, like say, as you see, it's nursing, medical, like these I put because I thought this could be useful for, like nursing, sonologist at least is a good thing. Okay, also a lot of things like social worker, like social worker is something is very common in those countries actually. Like example, like you are giving treatment and that person might have some financial issues, so they'll be referred to center link, or they'll be referred to social worker, child protective service. So for those particular things they need more manpower. Okay, so those subjects also have peer actually, so you can just search for them, like optometrist. Optometrist, no, they are not ophthalmologist, but they have the right of checking power, when that subject also has peer. Okay, great. Moving forward, a big question, I think this is the question I always got: is that possible to get job only after MC1? Yes, I know 14 of my students, many passed already. 14 of them, after passing MC1, they get the job. The way of getting job now, finish MC1, then finish the English test. Most of them finish the OAT, as far as I know, because it's more easier, and 2 to 3 years of experience. Without this experience, little tough to get, but it's also possible, because I know few people like without that much experience. So link, it is said that link contacts only matters in these countries, like, but it is not true. Link contact matters in every country. Okay, so remember this word, someday we will understand what Dr. Sharia told that time. Like link contacts, if you are isolated, if you think job will come to you, it is not true. You have to work hard, you have to search, you have to be social, you have to go to a lot of place to get the job. Okay, but it is quite possible after AMC1. How much clinical gap is acceptable? Okay, maybe that could be your next question, some of yours. There is no hard and fast rule, but it's better to keep it less than 2 years is better. You got my point? If it is more than 2 years, you have to come back to your country for like 3 months training. Okay, so the minimum training, please listen to me. How much training is acceptable? Minimum 3 months trainings, somehow you can show. But if it is below 3 months, they won't accept it. Okay, so some doctors living in Australia already, sometimes they come back to country. If it is possible, come back for 3 months. Okay, so even there will be some chances that you can make some papers, take some references, and you can show like for 3 months you were under some observation. Okay, so that's fine actually. So this is very important. Try to keep it, less than 2 years will be better. Otherwise you will be questioned later, why there is gap. But there is no such rule that you can't get the job, but you will be questioned like why you didn't get the job. And if after part 1 you want to apply for the job, if you don't have the experience, probably you are not applicable, like you can't apply for the job. Okay, things get much easy when you pass the MC part 2. You'll get more job offers because they might ask you for permanent registration number in lot of job places, so that time things would be easy. Another question, like doctor, do I need the PR always to get the job? No, it's not true. Many got job without PR, without Australian citizenship, Australian PR, many got job. So everything depends of your recency, how good your CV are, how much experience you have, how much interactive you are in the interviews. Okay, that's the thing that also matter. Many people fail to realize that. Okay, it's not about only English, like how good you are with the people, like how good you are while interacting, how good you are interacting with eyes. So those things matters. Okay, one doctor, is possible to get internship as IMG? Unfortunately, no, doctor. It's not possible. This is another common question I think I should have bring. Is it possible to do internship in Australia? No, doctor. Okay. And if it is possible, you might need to invest so much money actually, if you have that kind of link contacts. But eventually it's of no use. Later you have to do more training if you don't have like the internship in your country. You got my point? If you don't have internship, you have to go for even more training to apply for job. How much time required for AMC MCQ exam? I think 6 to 7 months. If you join our academy, like it might take 6-7 months. Okay, so 5 months is our courses and 1 to 2 months for revision. That's how things are going, and mashallah, we are getting excellent results. 2018's results were 108 appeared, 106 passed from our academy. Okay, so that's an outstanding result. Okay, this is another question. I'm currently in MBBS final year. What should be the best time to start the preparation? See, there is no hard and fast time, but I think if you are the final year, I think you should focus on your curriculum now, and side by side you can read some of the books like John Murtagh or Master the Board, this kind of books. Okay, if you pass MC1 or PLAB 1, is there any other way, any other exam apart from MC Clinical? Yes, there's a good option. You can apply for New Zealand, like directly appear in New Zealand exam, the final. It is called NZREX. If you don't know about this, please just type NZREX exam. You will get to see in Google. So after passing NZREX, you can start your job in New Zealand. One doctor asks, we need to do 12 months internship in Australia after passing MT2 with permanent registration. No, doctor, there is no such rule like this. It is totally fine if you have your internship in your own country, also training in your own country. Those are applicable. This is not USMLE exam. Like lot of things are contradict with USMLE and AMC. USA is much developed country. Like they don't bother like who you are. They will train you at the end of the day. But Australia does not have that infrastructure for doctors training and all those things. So they want the cream. So they want a ready-made person rather than a fresh graduate. USA, they just look for the marks in the exam. AMC still they don't look for how much marks you got. Still they don't look in that way, but someday there will be more competition, that time they might look around your marks. Okay, I hope so that helps. So again, the English test popped up. So the summary: English test is not required for the exam but for the applying job in case of AMC. Okay, about the PESCI, please go to our YouTube channel. We'll make a nice video on PESCI. There's another alternative way to work in, I think, sorry for spelling mistake, Australia it should be. Like there's a PESCI. You can also search with PESCI in online. You'll get like this any other alternative way. But to appear in PESCI, you need to get a job offer first, and you can get a job offer if you have some experience. That's the thing. Okay, and this is our YouTube channel. You can just search with my name in YouTube, and please do subscribe to that channel. So there are a lot of videos I made. How to take preparation, I gave demonstration with books. You can go and see them. Okay, and more videos are coming. When you go to the channel, if you just click that one, the page will pop up. Okay, now here's a question. One doctor asked, do you need any clinical experience after passing MC2? Yeah, of course you need experience, and that experience you can take from your own country. So another frequently asked question: how much time required to take after MC1 2? There's no hard and fast rule. Whenever you are ready, you can go for the AMC Part 2 exam. There's no such time limit. Only when you are ready. But that exam you have to appear only from Melbourne, Australia. Selecting a pathway. Okay, let's not make it complicated. Your pathway, while you are registering over online, your pathway choose standard. Most of you are junior doctors or senior doctors, no matter, you choose standard pathway. Okay, now something might came for the specialist. That's a totally different thing. For that one, if you want to know, please contact me with these numbers. But let me tell you about the Asian consultants. It is a little tough to you can't really skip the MC. The task they give, it's pretty tough actually, like to do. Like they will ask you, okay, you need to do this training, you need to do this. And if you're a consultant leaving your job and getting there and doing training for few years and then again get through an exam, that's pretty tough actually. And those exams does not have that much guideline as like MC1, MC2. This thing have guidelines, but those exams has very less guidelines, so you'll be really confused actually. Another thing, competent pathway. What is competent pathway? That's very interesting. So if you can pass the PLAB exam, PLAB both part, and if you can finish the foundation training in UK, like for 1 to 2 year, the foundation training, after that you can apply directly in Australia. In that case, AMC exam will be exempt. I repeat, you can exempt the MC exam or you can skip the MC exam if you pass the both part of PLAB and you already got a job and you 2 years of training, 1 to 2 year. It's called foundation FY1 and FY2 training. Okay, so that's the thing. It is possible. I have seen doctors getting job like that, but you need to cover some of your gap by getting back. See, they don't give emphasis only on gap. There is a another word, it is called recency. Example, even though you have a 10 years gap, you can do some training, which is called CPD training. Secondly, you come back to your country and do some training for like 6 months. So your recency would be very rich. So with that one, you can again apply actually. Okay. And as I said, laying contacts matters. Keep good relation with doctors and also the hospital HR. Okay. There's another question. So I want to tell you that we have provisional MBBS certificate, a very common question for intern doctors. Many came to my office with this question. So this equivalent to applying for, like, answer is no. You need the full certificate, not the provisional one. Okay. There's another question comes often. If I pass MRCP or MRCS, do I need to clear AMC? The answer is again yes. You still have to, but they will give you some emphasis. They might give you some more money, but it's not like you finish MRCP and they are directly offering you a specialist job. It is not true. You could be a register of internal medicine. You could be a senior doctor. You could be a CA, but not a specialist directly. To be a specialist, you have to go through the Australian system. Okay, so these are the things. I hope so this was helpful. Okay, there's another false rule. Is it true that there's no job available in Australia? This is really funny. In fact, among my students, 14 are working. Just in 2018-19 session, they got job. So, and many I know they got job like this. So there's a false number. People don't get job because of their CV, their recency, and their clinical gap, and they start accusing that Australian government that. And everywhere you go, there is always competition. Example, I'm living in Dhaka cities, and many of you are here attending this session, like, from Bangladesh, just giving example. So you tell me, like, some of the best quality hospital, like Square, Lab 8, Apollo, if you go, like, as a junior doctor, they won't give you the job unless you have some experience and you have a good CV and you have some good contacts. So same thing applicable everywhere. Okay. So I hope so you got my point. There's another thing often they ask, like, I'm a busy doctor, any special tip for us? Okay. If you're a busy doctor, you start preparation with that. We have a full recorded course for you as well, so that you can see at your convenient time. And one more thing, like, just a special tip for them, take at least 1 month break, from your job for study before those exams. That I hope so you can manage, and that will have a big impact. I'm telling you, that will have really big impact on the main exam. Okay, some doctor think, okay, yeah, during doing job, that might have bad impact. Okay, so please listen to my word, those of you who are busy practitioner. If necessary, quit your job for a month, but most cases I hope so you can manage the job. And otherwise, so many money will be going into Australian Ocean. Okay, this is the thing. And our Facebook group is Sharier's MC Guideline. So I'm sure all of you are here, and those of you are not here, like, you can subscribe. Okay, and here is a nice difference given between these mainstream exam. If you are a junior doctor, please take a picture of this one. If you're a junior doctor, please take a picture of this one. This will really help. Like, I put the outline, how differentiating point between AMC, PLAB, and USMLE. One thing to start it with, the costing is always high in AMC and USMLE, which is cheaper in PLAB. Only the thing I'm telling about the exam, but air travel, living, everything is similar. In fact, the city London, that's even more expensive than Australia or even maybe New York. Salary is in UK is a little poor, but more better in Australia and USA in early days. But in UK, when you get more experience later, your salary would be increased. There's also provision of locum. Locum, I'm sure you understand. Like in local Bengali, we call it cap. That means, like, the extra duty. There's always provision of doing extra duty in every country. So you can earn more money by that. Job facility, a bit more nowadays. Average 2018 went good, is always average. But after Trump coming, I think there was little issue with visa, but job is there even in USA. Matching issues, nothing, no, yes. In USA, there is a system called matching. You have to go through 3 years of training. No matter wherever you are from, you need that 3 years of, residency training. Okay, so this is so important. Quality of life, good, excellent. I think good for all of them. I should not tell excellent. I think good for all of them. These are very good countries to live with. Visa rejection is a little bit more high in case of USA. Parts like 2, I would say 4 in USMLE. Step 1, step 2 CK, step 2 CS, and there is another step 3. So it's a quite lengthy procedure. Popular exam, I think PLAB and USMLE is more popular than AMC. It is because people don't know that much about AMC. That's the reason. Okay, then first job takes time. Yeah, less, average, more in case of USA. Entering training, yeah, you can directly enter into the residency training in case of USA. Working hours, I think more in case of USA, because during the residency training, there'll be steamroller. One doctor asked again the same question, like the same type of question every time. Do we get training job after MC2 or get observership? Yes, it is possible. Again, the same thing. It depends whether you have some experience or not. Or after passing MC1, talking about the observership in Australia, that's possible. Okay, so you should go visit different hospital. You make a good CV. So make your CV good. There's some local agencies, they also help making you a good CV. So they can help you for making good CV and while applying, because there's a word like the CV is when someone watch your CV, they watch it for like 30 seconds and after that they throw it away. So if it does not look good, so you know where to work, right? Okay, validity after part 1, time limit is there. Time limit, there's no time limit for AMC. Experience matter less in case of PLAB, doesn't matter in case of USMLE, but matters like at least 2 to 3 years of experience. Really matters for Australian Medical Council exam to get a job. Easy to pass, actually different exam, different thing. I think I would say the USMLE, especially step 1, that really it's a little tough, and it is more about scoring high. USML is all about scoring high. AMC is not about scoring high. You need to pass, but you need to have some experience in your country. Okay. In PLAB, score does not matter that much. There's some good forums, Sharia's PLAB 1 and 2 guideline, PLAB forum. For AMC, Sharia's AMC guideline, and MedX. For USMLE, USMLE forum. So these are the 3 big and more popular exams, could be helpful. Okay, now this is a nice question by Dr. Anleb, like, so house job done or no, it doesn't matter, as it is only, I think if you have your house job, it would be better, because we, like, most of them, I think they're knowing that, you're from Pakistan and, there's like house job. So they, if they know that thing, they might, they're always there to ask questions. So they might ask you, what about your house job? Okay. But, if you have a standard internship, that is not supposed to be matter that much, but it is better if you finish the house job. Okay. Don't give them scope. Okay. So that's the thing. So end of session 1, let's take a break, and we'll just starting in 2 minutes after that with a recall class. I hope so all of you are going to enjoy that session. Okay, so so this is Dr. Shariar again. I'm the CEO, founder, and chief teacher of Shariar's Medical Academy. And these are some of my contact links. This is my Facebook page, and you can check. And this is our office. You are cordially invited in our office. Every Friday, I'm there for the intern doctors, senior consultants. Anyone can come and ask me questions. I don't mind. Also, you can send us email. We'll answer you back. Okay, so share your MC guideline. That's the email. So if you have any inquiries, you can put us email. We'll appreciate email, as I said, because Facebook Messenger, my Facebook is just like a road rush. Yeah, so there's often chances I might miss the messages. Okay, so you give email, so it'll be fine. So this is the end of session 1. We'll stop here and we'll start the session just after 5 minutes. Okay, with a recall session with all of you. So thank you so much. I hope so the session was useful. If you find the session useful, please write something. Please write yes, or I'm not sure was it useful or not. So just before I left, just want to know, already some people left. Okay, so if the session was helpful, just let me know if it was helpful for you. So thank you so much and have a nice day.